Again, good morning, everybody. My name is Mark Gauze. I am with the 911 Services Board, and part of my duties is to oversee the 911 Advisory Council Educational Initiative. So I am pleased to have with us Russ Clark, who I've been wanting to do this for quite a while, but concerning TERT. And before we get started, I want to allow him a chance. I would like to give I would like to give him a chance to introduce himself whenever he begins. But beforehand, please, if you would put in the comments your name and email and organization or agency. That way I know where to send the certificates when they are printed up. Um, Also, there is no AI or any read assist on this. It will be recorded and will be put on the new website within the next couple weeks. So, other than that, I ask that you keep your microphones muted unless you have a question. And other than that, I will hand it over to Russ.
Thank you, Mark. Can everyone see my screen?
No, sir. Um, it says that you're able to share.
I'm clicking share, but nothing's happening.
Would you like to send it to me and then I'll put it up there, Russ?
Okay.
Give us just a moment, folks. While we are waiting, again, if you're just joining us, if you could put your name, agency, and email address in the comments. That way I can make sure that you receive the certificate when they are printed up. Government email, you gotta love it.
Did you get it, Mark?
Um, Not yet. Sorry about that, folks. I'm hitting refresh and it's not doing anything, so there it is, Russ. I got it. Can you see my screen?
Mark, we can see your screen.
Yes, yes.
Thank you. All right, Russ. Are you there, Russ?
Okay, I'm there, I think.
All right.
Okay.
I can hear you.
All right. So what can TERT really do for you? Let's go to the next screen, Mark. I am the Russ Clark State Coordinator for Kentucky for TERT. Also Director of Bluegrass 911, serve on the Kentucky APCO Executive Board, Kentucky 911 Advisory Council. Got almost 23 years in now. Will be next month with 911 here at Bluegrass. Go ahead, Mark. TERT is the Telecommunicators Emergency Response Task Force. To break it down into more common terminology, I guess, for emergency responders, that so your mayors and county judges and police chiefs and sheriffs may understand, it's actually mutual aid resource designed for 911 only. Uh, it enables the deployment of trained dispatchers to support the 911 centers throughout the Commonwealth, um, operate at a state and national level. We have done both very successfully. And again, it's based on the same model as fire, EMS, and law enforcement mutual aid. Somebody needs help, we go assist them in their time of need till they can get their feet back under them, and then we gladly bow out and let them go about their daily operations. Next screen, Mark. Our board, TERT, is basically made up, it's founded by NINA and APCO. Our Kentucky board is made up of Jimmy Kitchens is the president. Laramie Scott is our vice president. Secretary is vacant at this time. Candy Wilson is treasurer. I'm state coordinator, and the APCO representative on the board is Jody Duncan, and the NENA representative is April Dunbar. Next screen. We follow the Kentucky Emergency Management map with areas. We have broke them down in regions. We have a coordinator in each region. Currently, Region 8, we are looking for a coordinator. So if anybody in Region 8 area is interested, please reach out. You can reach me at that email address up there or my cell phone number, either one. We follow this map because we have to operate or get activated through emergency management. That's our point of contact. So it was easier for us to relate to them by using their map with their areas. Next screen, Mark. 1992 was the first large-scale, long-term mutual aid deployment. It was Hurricane Andrew. At that time, it was deployed under the Florida Fire Chiefs Mutual Aid Program. Then in 2001, North Carolina chapter of NENA developed the first telecommunicator emergency response task force program. And ironically, in 2024, they were the recipients of a lot of help from different states. Go ahead, Mark. History of Kentucky TERT. In 2017, we developed an agreement. In 2022, the new Kentucky TERT board was formed by NENA, KENA, and APCO. In 2023, then KYM Director Jeremy Slinker signed our first formal agreement between KEMA and Kentucky TERT. Director Slinker actually started as a dispatcher at KSP Post 7. He understood the need for TERT and the value that TERT brought to the table. And since that time, we have worked arm in arm with KYM, becoming more integrated into their system. And they're trying at this point to try to get us the same as their IMT teams that they deploy on disasters. September of 2023 was our first in-state deployment to Union County. That was shortly after the Kentucky Emergency Services Conference. And then in October of 24, our first EMAC deployment to North Carolina was during Hurricane Helene. And if you all can remember, that was a devastating for Florida and North Carolina. And we were lucky enough, I will say, to be able to get involved at a national level. All reports were Kentucky was well represented. We worked with Florida, Alabama, Ohio, South Carolina, and Georgia, and Kansas, I think, were the states that were all involved in that deployment. So it was a pretty big deal for us to only be a year old and be requested to come on a national deployment. That is primarily due to the contacts that had been made in previous years with other state TERT coordinators, and they asked us to come along and kind of show the people that we sent the ropes on how to deploy in a national event. Next screen, Mark. The Joint TERT Initiative is a partnership between APCO and NENA to promote TERT programs that satisfy deployable status criteria or mutual aid responding during disasters. It's an umbrella organization intended to foster the development of individual state TERT programs. You develop your own program to what you want it to be, how you need it to be, as long as you meet the criteria of the National Joint Initiative. Next screen, Mark. This is why we need it. It's not when, but it's not if, but when a disaster strikes. Disasters are inevitable. It helps prevent burnout, maintains morale, and keeps 911 services stable. We don't plan on coming in and totally taking over. That's a lot of misconception that some people have about TERT. We want to come in and give your people time to take care of what they need to at their own homes, because they can't be their best for your responders if they're thinking about what's my house look like, how am I going to get it cleaned up, I can't take off, this type of thing. So we come in, assist them, in-state deployments, or however long you need us for. We support during national disasters, tornadoes, floods, ice storms, line of duty deaths, first responder funerals. Next screen, Mark. All of our people are trained and vetted, mission ready. We have, in Kentucky, we have the academy that all people have to go through. They have to be able to integrate into your 911 center quickly. One thing that helps us do that is if all the 911 centers would prepare what I call a down and dirty list, 20-minute training of how can I operate in your PSAP in an emergency. And that takes a lot of the stress out of it and cuts down on a lot of the efforts that a lot of people think are overwhelming at that time. It's short-term relief that protects long-term well-being. We have peer support benefits, dispatchers supporting dispatchers. We're also working on an initiative to be able to deploy people trained with crisis management and counseling, not only to help our people while they're deployed, but to help the people that we're going in to support. Next screen, Mark. The way you contact TERT is contact the state, contact your local emergency management director. They should contact the state EOC. State EOC will contact me. I will make contact with the requesting agency to see exactly what they need, how long they're going to need us, and then I'll put a team together and get all the contact information and get everything set up. In-state deployments are similar to mutual aid for police, fire, and EMS. We normally request availability in-state for up to 1 week, maybe shorter or longer, depending on the event. Out-of-state deployments through EMAC, our FEMA requires 14 days availability and a declared disaster. You may or may not be there 14 days. You may be requested to extend. Financial responsibilities in-state, in our agreement that your agency signs with TERT, wages, liability, and workers' comp are responsibility of the sponsoring agency. On state and federal declared events deployed under FEMA and EMAC protocols, reimbursement may be available for travel, wages, and lodging. This does require extensive documentation. There is a ICS 214 form that has to be kept daily, and also a travel voucher, logging your mileage and your expenses. And we've opted to go with per diem because it's just easier to do a per diem rate on your meals than it is for the people responding to have to keep up with receipts and turn all those in. During the deployment, we have to have a clear point of contact at the 911 center. There is a term team leader assigned on deployments. They're the one that I contact daily or sometimes multiple times a day to see if they need anything, how everything is going, if I can do anything or they need anything. You will be assigned to specific roles and responsibilities. You may be just assigned to dispatch only fire or only a law enforcement, but you do whatever's needed at the time when you get there. And you are expected to document your daily activities. And that's not every minute of every day, but a highlighted overview of what you actually did. And then situation reports are sent back to your sponsoring agency to let them know that you are surviving and what's going on and where their people are. To be eligible, you have to be KLEC certified, 2 years of full-time communication work experience. There are several FEMA independent study courses that needed. All of those are online, so it's pretty easy to get. You need to be EMD or TCPR certified, full access CJIS certification, and an agency support letter. We also are trying to work with KYM to get telecommunicators credentialed in the state, because that is a new FEMA requirement. We've been signing off on grants for years that we are NIMS compliant, but one of the NIMS compliant is compliance requirements is that your certifications and credentialed, and now KYM is coming up with credentialing, and we're working on getting that so that if we're deployed again on an EMAC situation, we will have the requirements to meet it federally, not have any hiccups in the problem. Next screen, sir. You can expand by being on the TERT team. You expand beyond your 911 center, build relationships across the state and the nation, gain valuable experience in disaster response, provide peer support when others need it the most, and represent your community in times of crisis. Next screen, sir. Here's a map of the state. The red shows where we have members on our TERT team currently. If anybody's out there that's interested in joining, please reach out to myself or a regional coordinator or the Keena APCO website. We will definitely looking for people. We've got 116, 17 PSAPs in the state, and I would love to have at least one from every PSAP in the state. Right now, we've got about 68 members, but not one from every PSAP. Next screen, sir. Here's some of our deployments. Again, the first one was Union County in September of 23, Elliott County, Winchester 911, Russell County. Those were all line of duty deaths in some way or form. Hurricane Helene was a October 1st to October 21st, I think, deployment to North Carolina. We sent 4 people down on the first group. Then 2 more went down, and those 4 came home. The last 2 people stayed for, I think, 10 or 12 days. Carter County was a line of duty death. Washington County, same. Jessamine County, same. London and Laurel County was after the tornado hit. They needed some relief up there. And then the Bowling Green was a line of duty. Next screen, sir. Hurricane Helene, again, was our first EMAC deployment. It ran from October the 1st to October 22nd. They worked in Asheville, North Carolina at the 911 center. Total of 6 team members went. Again, Alabama, Florida, Georgia, Nebraska, Ohio, Texas, and Virginia TERT teams were there. So these 6 people from Kentucky represented us well, had a vast amount of knowledge they gained from working alongside people from other states. Next screen. How do you get started? An individual application online available. Request MOUs with Kentucky TERT through regional coordinators or state coordinator. Attend TERT membership meetings, and we have training opportunities throughout the year. Next screen. These are some of the comments of people that were deployed, have been deployed. Abby Cummins was in the second group that went to North Carolina. She's also deployed in-state on some of the line of duty desks we've handled. April was my team leader in North Carolina, did an outstanding job. And it was definitely chaos when they got there. A lot of misinformation had been put out. Nobody had told the North Carolina dispatchers we were coming. They thought everybody was there to take over their jobs, and they'd lost their homes, so they were really at a wit's end. And some of them were sleeping under desk in the 911 center because they didn't have a home to go to and they didn't want to go home. And Dewey Birchfield's been on many deployments within the state, and he also went to North Carolina with KSB. Next screen. That's all I have. Unless there's any questions, I'll be glad to take those at this time.
I would like to echo what Russ said is that we have 117 call centers, and it would be great to have one, at least one or more from each PSAP to help in times of crisis. I know that I have never done TERT work, but I have done volunteer work and mission work and everything, and it really does change the way that you view the world. It changes the way you feel about yourself and about humanity. It is your way to give back because there's going to come a time when Kentucky's going to need it too, or your region is going to need it. And we've already seen that a couple times here. So um, if you are interested, I'm going to send out an email that has Russ's contact information, the TERT application, and so on to everybody that has signed up for this, so that you will have that information at your fingertips. Uh, and if there are no questions, you can put it in the chat, or you can email Russ yourself. Again, if you joined us after I'd already made the announcement, if you will please put your name and email and agency in the chat box. That way I will know who and where to send your certificate when it is printed. Other than that, Russ, I thank you so much. Like I said, we've been wanting to do this for quite some time, and everything just keeps coming up. But I believe this is a very valuable thing for our state and our country. And so thank you, Russ, for that and for your volunteer work and all of that. Other than
Thank you,
that,
Mark.
oh, you're so welcome. Other than that, I hope you all have a great afternoon, and we'll see you at the next educational initiative.